Hello. I'd like to briefly talk about the weight loss injections that have been a hot topic recently. These are medications that were originally developed to treat diabetes. These medications, known as GLP-1 analogs, work similarly to the glucagon hormone in our bodies. They bind to GLP-1 receptors, which suppresses the feeling of hunger. They also delay stomach emptying, which prolongs the feeling of fullness, and in this way, they help us lose weight. Of course, like any other medication, these drugs do have some side effects during use. It's important to be aware of these. Specifically, if used under a doctor's supervision, these side effects are minimized and are generally at a tolerable level. The most common side effects we see are those affecting the gastrointestinal system. Side effects such as abdominal pain, nausea, vomiting, bloating, diarrhea in some patients, or constipation in others may occur. And during treatment, about 5 to 10% of patients discontinue the medication due to these gastrointestinal complaints. More serious side effects include the formation of sludge and stones in the gallbladder, pancreatitis, and pancreatic cancer. And in individuals with a family predisposition, they can also lead to the development of medullary thyroid cancer. Similarly, there are reports that they can also cause vision loss in some patients by leading to optic neuropathy. For this reason, before starting these medications, patients must do so under a doctor's supervision, and a detailed medical history must be taken. If the patient has a personal or family history of thyroid cancer or a risk of pancreatitis or pancreatic cancer, the use of these medications is absolutely not recommended. During treatment, patients must have routine blood tests. Their thyroid function tests must be closely monitored, and to watch for the risk of pancreatitis, patients must be monitored for their amylase and lipase levels. And if necessary, eye examinations must also be performed. It's important to remember that these are not medications that cure obesity. They simply help with weight loss by suppressing appetite and prolonging the feeling of fullness. It's also crucial to address the underlying factors that cause obesity and weight gain. What are these? Things like insulin resistance, unregulated diabetes, eating disorders with a psychological origin, hormonal disorders such as Cushing's disease, and also thyroid dysfunctions. If these exist, they must be addressed concurrently. Only by doing this will the weight loss be permanent. Otherwise, when the medication is stopped, the weight that was lost will be regained. During the course of treatment, lifestyle changes, regulating one's lifestyle, managing eating habits, and getting regular exercise are all strongly recommended. Obesity, unfortunately, is a metabolic disorder. Alongside the medication, correcting the underlying metabolic issue, making lifestyle changes, and exercising must all be made a part of the treatment.